Hello everybody, we're a little late here. I'm just going to turn the camera around so we can see everything okay. And let me just make sure that you can see everything here. Right, great. So, hello everybody, happy Friday. It is a little after 2 p.m. Started a little late today, so I do apologize. And so today we're going to be talking about trauma-informed care. So before I get into that, because that's a huge topic, I could go on for hours about it, but we're just going to get an overview today, so you can kind of understand a little bit about what it is, start thinking about it a little bit more, maybe come up with some questions, and we can always, dive more into the topic at a later point, or if you're ever interested in more information, as always, you can reach out. But before I get into it, I just wanted to remind everybody, I did put out the schedule for December. So we're just doing this, obviously, today. So it is December already. Wow. So we're doing our topic today for this Friday. And then we have a topic next Friday and the Friday before that. We won't have one for the last Friday of the month due to the holidays. But we will have some coming in January. So keep an eye out for that. And so if you're wondering what our Instagram lives are going to be for this month and next month, just keep an eye on our social media. And if you follow us on our social media, you would have seen that we posted about our other pages. So if you're on Facebook, like us on Facebook. We're on Twitter, so follow us on Twitter. And of course, Instagram. So if you obviously already on here, hopefully you are following, following us. I can remember the different terminology, but following us on Instagram. We do have a specific Instagram for our youth and teenage clients or people who are just more interested in the youth-related stuff on our SHFL Young Voices page, which I've included that on all of our pages. And then we're also on YouTube. So I will be posting the video on YouTube after. Obviously, it's always available on our Instagram page. So we're on YouTube. It's just Safe Harbors of the Finger Lakes. So just want to throw that little blurb out there. So if you're wondering where all this stuff goes or just want to keep up with everything that we're doing, right, especially with the pandemic and people working from home and schools virtual and in person, and it's just a good way to keep up to date on what we're doing and hopefully learn more, not only for you, but maybe your friends, family, or people who might need the support or resources or information. So like always, please tune in, or if not, we will have the video saved afterwards so you can watch it later. Like I said, we're discussing trauma-informed care. So if you're not very familiar with it, that's okay. It's a very like I said, detailed topic. I won't go into a lot today just because of time, and I don't think anyone would want to sit and watch a several hour long Instagram live video at this time. So I just want to kind of get an introduction to this topic so you're a little bit, more familiar with it. So before I forget, I always give a content warning, especially, trauma-informed care. I will be talking about sensitive material. It actually kind of goes hand in hand it'll make sense a little bit more later, but just being trauma-informed means being aware that other people might have experienced trauma, which is why I always give content warnings. Because if the material in the video is sensitive or difficult for someone to watch or listen to, that might trigger something from a traumatic experience for them or traumatic experiences. So that's actually kind of why that is why we do content warnings. So with that, before I begin, I just got to do just a disclaimer. So the views and opinions expressed in this video are not those necessarily of Safe Harbors of the Finger Lakes, but those of in the video. So with that, we will get into trauma-informed care. So I'll just kind of give a quick definition. I always like to use this definition because it captures it really nicely. I can't take credit for this because it was actually from the Substance Abuse and Mental Health Administration. So according to them, and quote, individual trauma results from an event, a series of events, or a set of circumstances experienced by an individual as physically or emotionally harmful or life-threatening, with lasting effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. I think that's a wonderful definition. I use that one all the time. It definitely captures, because trauma can be a little complex and hard to understand sometimes. It just captures that, trauma can affect us in so many different ways, and it's, very an individualized thing and experience. So just being aware of that. And this is what trauma-informed care is just being aware of other people's trauma or experiences and how to, put that into practice per se, especially people who are most likely working with people on a daily basis. I mean, obviously everyone should just be trauma-informed in general, but it's especially important for people who are working with people every day. So like my job, I work with people every day, being trauma-informed and aware of people's experiences and how I can help them to feel as comfortable and safe as possible without hopefully, triggering them or re-traumatizing them, or just making sure they feel as safe and, as possible. And with that, it also is going to build trust if you're taking that awareness into account, just being aware that that person might have gone through something. So trauma can stem from so many different things, and I have this behind me. It doesn't even capture probably everything, but it captures most of it. So it can stem from not necessarily all these things, or not everything for every single person. Like I said, it's a very individualized thing. But for example, trauma can stem from war and other forms of violence, physical, emotional, or sexual abuse. Medical interventions can be traumatic for people. Grief and loss, of course, accidents and natural disasters, and lastly, cultural, intergenerational, and historical trauma can also be obviously traumatic. To talk about two different trauma-specific disorders. And by all means, I'm not a complete expert in this area, but just this is just some general knowledge about these things. There's so much research and information about this, and this is, if you're interested in learning more about specifically trauma disorders and trauma in general and the psychological information behind that, there's obviously tons of great research out there and information, and we can always share that with everybody. So to kind of break down the two trauma-specific disorders, there's acute stress disorder, or ASD, that usually occurs within the first month, of the experience. And then there's post-traumatic stress disorder, which I'm sure you all usually hear. It's PTSD. I have probably never really heard of ASD before, learning all about this, but usually I hear PTSD, which that usually obviously occurs later than a month and throughout the rest of someone's life. So I always like to share this quote. It's from a researcher, S.A. Green. It is not the event that determines whether something is traumatic to someone, but the individual's experience of the event. So like I said, not everything's going to be traumatic for every person, like the same event, but it's how that person responded to the event. There might be other past experiences that might make that event seem more scary or traumatic to them. So I always like to use the example of a car accident. Two people get in a car accident the same exact way. They're probably going to have different experiences. One person might have been a little shaken up, but they're fine. They move on with their life. Another person might have responded differently. Maybe they are scared to even go in a car ever again, or they're always paranoid when they're driving around, and they might have had two totally different experiences, but the same event happened. So that's why trauma can seem a little complicated, because people experience things differently. So just being aware that just because you went through the same or similar experience, and that kind of goes with the empathy versus sympathy thing I've discussed many times before, including last Friday. Just being empathetic is going to be important. Just because you went through the same experience, you experience things differently. I know that's kind of a complicated thing but just because you experience the same event, you experience it differently. I shouldn't use experience twice, but I did. You've gone through the same event as someone or something similar, you're probably going to have completely different reactions to it or lasting effects from it. So just being aware of that, that's being empathetic of that. And just being aware that, trauma is different for everybody. So to kind of go, and I like I said, I could talk about this forever, but to go into trauma reactions, there's two different types, type 1 and type 2. Type 1 is also known as simple PTSD, and type 2 is also known as complex trauma. So simple PTSD or type 1 is, generally an older age of onset, shorter duration of trauma exposure. So like I said, maybe there was just the one traumatic event or a couple traumatic events spread throughout their life, or they weren't like all the time consistently happening every single day. Maybe it was just one thing, but it doesn't mean it's not any more traumatic or less than traumatic of anyone else, but it's just a one-time event. It's not consistently happening over your whole life or every day or throughout your whole childhood. And so generally these people are able to have they've had secure attachments. So secure attachments are, so as an infant, your caregiver, whoever was raising you, provided a safe, nurturing environment. People who have secure attachments tend to develop better relationships, tend to feel more comfortable with new experiences. And this is not the same, true across the board, but that's just tends to, if you grow up in a nurturing, caring environment, and so you develop those secure attachments, you feel a little more comfortable being independent and all of that. So type 2, which is also known as complex trauma, it's generally a younger age of onset, prolonged trauma exposure. So this is where I was talking about it's happened over a long period of time or every day, or it's pretty frequent. And these people usually develop insecure attachments, so that's obviously the opposite of secure. So as an infant, your caregiver wasn't usually around or taking care of you or nurturing you. So generally those people with insecure attachments tend to feel that adults aren't reliable. They don't have that trust, because no one was there for them when they were younger. They kind of had to fend for themselves in a way. So these people tend to have a hard time developing relationships due to the lack of trust or just feeling uncomfortable around people. They tend to have a lot of anger issues, stressed out all the time, anxious, especially in social situations. So that can make it a little complicated. So that kind of goes into what is known as ACEs, which is also, that's so short for adverse childhood experiences. ACEs is a whole nother topic I could talk about forever too. It's a really interesting thing to learn about. So ACEs are, potentially traumatic events that occur during childhood, so obviously 0 once you're born to 17 years old. And ACEs, or adverse childhood experiences, usually it's actually pretty crazy. Almost 50% of children in the United States have experienced at least one ACE, and I'll go through what the ACEs are in a second. And about 1 in 10 children have experienced 3 or more ACEs, and that's just obviously a statistic. It's pretty straightforward. And once I go through these ACEs, you might think to yourself, maybe I've experienced that, or I know somebody who's gone through these experiences. And like I've said before, you might not know if someone's gone through it, because that's up to them if they want to share that. So just being aware that people could have had experienced these things as in their childhood. And that doesn't necessarily mean they have PTSD or they're traumatized. It's just it's just kind of an indicator tool to kind of tell, they've had all these experiences that might have made their childhood more difficult, or their adulthood, or it's just a way to recognize those experiences that, shouldn't be happening. It's never going to be an ideal, maybe, environment, but, being nurtured and cared for and having healthy relationships, and I'll go through the ACEs in just a second. It's just very helpful for development for children, since your childhood development is definitely the most crucial, obviously, for brain, physical, emotional, social development. So there's 3 different categories of ACEs. So there's usually abuse, so that could be your physical, emotional, or sexual abuse. And there's neglect. So neglect is like lack of attention, in a way, to simplify it. So there's lack of physical or emotional care, so that could be touch, so holding them, hugging them, stuff like that. Or emotional, saying I love you, I'm here for you, just obviously supportive words that make them more emotionally comfortable. Man, I'm having a hard time. There's a lot of big words that I'm explaining. So I apologize in advance. And then there's household dysfunction is the other category. So that tends to be there's mental illness in the home or where you were growing up, an incarcerated relative. So someone was in prison maybe for a period of time or most of your childhood. And that doesn't, when I say family, it's anyone that you were raised by your guardian or parent or extended family, anything like that. Substance abuse was involved in the home. The mother might have been treated violently. There might have been some sort of domestic violence in the home. And that's not necessarily just physical. It can be emotional, mental abuse of any sort. And you've experienced or witnessed that. And divorce. So a broken family of some sort. Both parents are not in the home, which could lead to other complications. Your parent not always being there, just seeing a broken relationship, what have you. So just keep those in mind. So that kind of goes with, that wasn't on there. Okay. But yes, just ACEs are kind of go with the whole trauma related stuff I was just talking about. So the impact of ACEs. So you're like, whoa, I've experienced one of those, or I know someone who's experienced one of those. That doesn't necessarily mean that there was an impact on them, but just being aware of that, that it might have had an impact on them. So they found that ACEs can have a huge impact on people. In terms of, physical injury, there could be traumatic brain injury, and I'll kind of go into like how this affects the brain development in a little bit. There could be fractures, burns, obviously, or anything like that from the physical abuse. And then mental health, there could be depression, anxiety, possible suicide, or PTSD, which I just talked about a couple minutes ago. Maternal health can be affected. So your mom, a parent who's giving birth, or someone who's giving birth, and unintended pregnancy, pregnancy complications throughout the pregnancy. They might have a hard time giving birth, or there might be some health complications for both mom and the baby. And fetal death could also be a complication due to an ACE. And then there's infectious diseases that could, you're at higher risk for, possibly HIV, STDs, and that's due to possible risky behavior or so like unsafe sex. And then alcohol and drug use and abuse are also considered risky behavior. And then chronic disease is also common, and that includes cancer and diabetes. And then, opportunities. This might have prevented you going through to get an education, or your occupation. It might make it difficult to do a certain job, and it might also affect your income due to these things. So what does trauma or excessive trauma do to the brain or the development of the brain? There's a lot more, but I'll just touch on the basics of it so you can kind of have an understanding to why people with trauma have a difficult time with certain things in their life, or that's why I want people to be trauma informed. So with extensive trauma, there's a decrease in the prefrontal cortex, so that's in charge of the memory and learning. So if it decreases, then obviously they'll probably have a harder time with memory and learning. Which can be difficult, especially since if it's happening during their childhood. That's important because your brain development is obviously the most important during your childhood. You're doing your most year of learning, experiences in terms of social, emotional, physical, development. So that's going to affect that. And then it can also increase the amygdala, which is allowing it to be more receptive to stress. So they might be easily stressed out more. And then there's also an increase in neural connections, but not for the good things, for, related to fear, anxiety, and impulsive decisions. So that can make it complicated. And then but I want people to remember, because I know this is kind of like not a very positive topic to discuss, is that people are resilient, especially children. And resilience is like, I want you to think like elasticity, like you're able to bounce back, you're able to come back. Thankfully, children are pretty resilient. That doesn't mean, it's okay that these traumatic experiences happen, but there is a chance to, there's not it's not permanent, I want to say. And this, you can be resilient. It's just easier as a child to be more resilient from that. from chronic stress or any sort of stress that you're experiencing. So, resilience is, so if you're able to have a supportive family at home or a positive relationship in life, not necessarily a home life, but if you have, positive role models in your life, like teachers or friends or friends' parents or other people in your community that are able to be positive supports, that is always helpful. Able to handle the stress. So maybe you need to reach out for help or resources, like therapy or reaching out to school counselors or just for support systems, anything like that. So people are able to be resilient. They're able to, not let the trauma take over them per se. Trauma is pretty complex, like I said. So this is just like the overview of this, but people can be resilient, and they usually are. It's just a matter if they're able to, especially if they're having chronic stress. So this kind of ties into your fight or flight response system. So if you're in a situation and you get stressed, your body usually wants to fight or flight. It's just its natural reaction to a stressful event. So you always hear fight or flight. Obviously, fight, you stay and decide to attack whatever is stressing you out, or flight, you obviously run away from whatever is stressing you out. But there is also freeze and collapse immobility and tonic immobility. So freeze is just how it sounds. You just stop in your tracks, can't really control what you're doing. That happens quite a bit. And people are like, they don't understand, like, my body just stopped. I didn't want it to stop. I couldn't move. I just felt frozen. That can happen sometimes. The body just tries to shut down, and it just stops you right where you are. And you can see some good examples of this. There are some good videos on YouTube, and I can always share those later, representing what these things look like, or what they're like. And then there's collapse immobility. It's just how it sounds. I want you to think of like a possum, playing possum, like just dropping down and you just collapse. You're just on the ground. That can happen. Or tonic immobility, which is just, your body goes rigid. You kind of just like, whoa. It's kind of like, I'm trying to think what be compared to. I'll definitely share the videos because it's like really hard to kind of go into good explanation. It's easier to see than it is to explain. So I'll definitely show those videos on those different responses of the body in a stressful situation. So I want you to think of those. If someone's experienced chronic stress and there's more neural receptors for fear, anxiety, and stuff, things that might not seem to stress other people out are stressing them out. So they're constantly going through this fight or flight, freeze, and collapse and tonic immobility, which it does a toll on the body after a while, especially if they're constantly going through this. So this is going to have an effect on them if they have an increased stress response in general from the trauma that they might have experienced. So things, like I said, that might not seem as scary or traumatic or stressful to you might seem stressful or scary, traumatic for them. And that might be due to other traumatic events that they've experienced that have caused the increase in stress response. So I just want you to remember when you're thinking about this is there's 4 R's of trauma-informed care. So you realize the prevalence of trauma, and because I've only touched the surface. Based off of what I talked about, you're probably like, wow, I know someone who's gone through that, or I've gone through that, or it just seems very common, and it probably is. And like I've said, it's not, we can't make anyone share that with us, but just being supportive and just realizing that trauma is very common is just important to recognize that. So R, realize that the prevalence of trauma. And then number 2 R is recognize how trauma affects all individuals in their own way. And then there's the 3rd R, which is responding by putting this knowledge into practice. And I kind of can try to give you some examples of that in a minute. And then the 4th R is obviously, if you're able to do this resists traumatization, blah, 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 blah. It resists re-traumatization. So hopefully we are able to prevent this person from being re-traumatized, the best way we can. So, I want you to keep in mind is instead of asking what is wrong with this person, start asking what happened to this person. And like I said, they might not share that with you, but just being aware. So if you see someone stressing out or having a bad experience, don't just say, oh, like, what is wrong with them? Because, like, why would they act that way? Just be like, well, something obviously has happened to this person for them to respond in this way. And just being supportive, empathetic, like I said, so listening, providing any assistance that they might need. Like, I'm here for you. I'm here to listen. I'm here to support you. Those feelings are valid. I don't know what you've gone through, but I just want to, let you know I'm here to help you if you need it. And maybe getting them connected to any resources or support systems that they might need. So just remember, trauma is common. It is safe to assume that somebody may have a traumatic history. So don't ever assume that it's not. It's probably it's safer to assume that someone has experienced trauma. I'm having a very hard time talking today. I apologize. So just being sensitive, aware, and patient, and that eventually might help gain some trust with that person or persons. If you're able to listen and support them without judging them, without making them feel like what they're experiencing isn't real or valid, just being a very supportive and empathetic person is honestly the big part of this. And I told you all that I'm going to probably talk about empathy for most of my videos, and it is true. We're not perfect, but just trying your best to, be empathetic and listen and support. I think that's going to go a long way for the people who are having a hard time with certain experiences. Because if they see you taking that time to do that and listen to them and acknowledge how they feel, that's probably going to make them feel a whole lot better in that moment, and just know that, someone's obviously looking out for me. So I guess I could talk forever. This is already probably a long video, but I just, want to reiterate, there's so much more information about trauma-informed care, and I can get into more specific ways and how to implement this. I discussed this with medical professionals, how to implement this in your medical office, so your primary care doctors, your physical therapists, your nurses, the hospitals, how to implement that, maybe even implementing it in the classroom, obviously in your educational settings, or just implementing it anywhere. There's certain things that can help make it feel safer for people, and just being aware that people might be affected by how you say or do or set things up. And I mean that, and for example, in a doctor's office, the space itself, how it's set up, could be traumatic. If it's very tight and enclosed, there's a hard way to escape. They might feel uncomfortable or closed in. That could trigger a response. How a person talks to them is also, obviously going to possibly re-traumatize somebody. How they look at you. Maybe they'd rather have somebody in the room with them. Maybe if I'm speaking obviously towards maybe a doctor's visit, if they would rather have someone in the room with them to feel safer, being aware maybe they, it might be easier for them to have somebody in the room with them. Maybe they had an experience where it didn't go well. And I can go into those more later. So obviously I'll wrap this up right now. If you're interested in more information or to go into a deeper dive about trauma-informed care and what trauma is and ACEs, so those adverse childhood experiences, I can definitely do that. So with that, I'll end today's Instagram Live and Friday. I'm sorry it was a little messy all over the place, but hopefully you're able to learn a little bit more about trauma-informed care, what it is, and just recognizing that people have possibly all experienced traumatic experiences. Some more than some people have. This is the thing. Some people might have experienced more traumatic experiences than others, but that doesn't mean it didn't affect them differently. So just keep that in mind. It's just being open-minded and sensitive and, like I said, empathetic. So that's my advice for today, and always. So with that, like I said, if you have any questions, concerns, feel free to reach out to me. I forgot to introduce myself, but hopefully you remember who I am. So my name is Audrey Button, college specialist at Safe Harbors for the Finger Lakes. So if you ever want to reach out, you can call our 24-hour hotline, which is 800-247-7273. And you can always go to our website. It's www.shflny.org. And obviously always go to our social media. We're at, like I said, on Facebook, Twitter, Instagram, and YouTube, which I'll put this video on YouTube. And then check out our Instagram Live for next Friday. And I hope to see you all then. Thank you so much for tuning in or watching this video. And I hope you all have a great weekend. Thank you so much.